Hi, I'm Dr. Stephen Brazis, and I'm here today with two of my colleagues and very good friends, Dr. Locke Johnson and Dr. Michael Phelps. We're here today to discuss some questions pertaining to the oral surgery field of dentistry, which many of my patients have asked over the years. So, Michael, again to you. What if a lot of patients ask me, what if there's not enough bone for an implant?
Well, bone volume is very important with dental implant placement and long-term function of a dental implant. So we want to make sure a patient's bone prior to implant placement is at the best quality and a large volume. So placement of a dental implant into a substantial amount of bone is paramount for success. Patients sometimes will require grafting procedures to obtain a good foundation of bone, and something that's done typically in the office as a outpatient procedure under either local anesthesia or outpatient general anesthesia. Most of the materials that we use are something called a xenograft, which is bone from another animal. Specifically, we use something called BioOs many times, which is bovine bone, cow bone. We also will take bone from a patient's own jaws and transplant it into areas where there's deficient bone. There are other specific techniques that we use as well.
How do you determine which type of implant or bone graft you're going to use?
It depends on the volume of bone we need to regenerate and also the location. For me, bone in the anterior portions of the mouth, the upper and the lower jaw, I have better success using a patient's own bone that is taken from another part of the jaws and transplanted, held into place with a small bone screw. In the posterior regions of the mouth and in the sinus region, I like to use the bovine bone. It's less invasive for the patient. It's not a second surgery to obtain the bone graft, and we get very good results. The anterior region, I don't achieve as good results with the BioOs, so that's why I like to use a patient's own bone.
Okay, and you mentioned in the sinus area, is this related to the procedure that people hear about called the sinus lift? What is that actually, and how do you do that?
Exactly. Sinus lift is required in patients who are going to have implants placed in the posterior or the upper jaw, the posterior maxilla. Not every patient requires a sinus lift procedure, but there is a minimum amount of bone volume we need to ensure proper implant placement and longevity. If a patient has, in many cases, less than a centimeter of bone, 10 millimeters of bone, then we will many times recommend the patient have the sinus lift procedure. Once again, it is a grafting procedure that's done in the office, usually under general anesthesia. It involves placement, in most cases, of the bovine bone into the sinus, sometimes at the same time as placing the implant. And other times we will have, if the patient has a very large sinus with a small residual amount of bone, say 4 millimeters, then we will many times have to do the sinus graft procedure, let it heal for 6 months, and then go back and place the implant subsequently.
Terrific. I know that in the upper, you're generally talking about vertical amount of bone, whereas in the mandible, you have to take into account both the vertical and the horizontal components.
Correct.
Because of the thinness of the jawbone.
Absolutely.
So how exactly do you guys figure out how much bone and where to place an implant?
Well, we start off with plain film radiographs, something called a Panorex, which is a radiograph that's obtained typically in our office, a machine that circles around your head and shows the jaw structure, and this gives us a good baseline. In other patients who we need more specific information, such as where the inferior alveolar nerve is located, then we'll many times ask the patient to have a special CAT scan taken called a cone beam CAT scan, which will give us a three-dimensional view of the residual bone they have and the related structures.
Great. So with these kind of procedures available now, this is relatively new technology, I know, and
Yeah, absolutely.
with this type of technology that we have now, the risk generally of actually doing implant procedures is far less than it used to be, I take it.
I agree with that. Yeah, I think that we are better able to assess risk and prevent complications. Also, we're better prepared to reconstruct a patient prior to implant placement, and I think overall success is improved with these modalities.
Great, thank you. All right, well, I want to thank both you, Dr. Johnson and Dr. Phelps, for joining me today.
Thanks, Steve.
And for sharing your expertise with me and with our watchers out there. And I want to thank all of you for joining us today. I hope you found this discussion useful. I'd like to encourage you to check out more of my videos at www.totellthetooth.com. Please also check out my office website for general dentistry at www.toothhaven.com. Until then, this is Dr. Stephen Brazis wishing you all the best of oral and general health.